Let's talk about an otoplasty. Hi, I'm Dr. Pirko. Welcome to Ideal Plastic Surgery. Today we are going to talk about otoplasties. Otoplasties are one of those procedures that I have done a particular large amount of because I used to work at a children's hospital, and let's face it, most people who have an otoplasty are going to get it done when they're still kids, but many of them are going to be adults. The otoplasty is an operation that is done under general anesthesia. It takes about an hour, but the key is to do the right maneuver because there are several different maneuvers and we have to analyze the anatomy of your ear to figure out what exactly is making your ear look like it's sticking out. The most common change that we can see is that some patients may not have a proper fold in the upper portion of the ear. We call it the antihelical fold, and if that area is flat, what we have to do is recreate the fold. Another change that we oftentimes see is that the angle between the ear and the head is sticking out and it's greater than 45 degrees, and in those cases we have to fold back the ear. And finally, rarely though, some ears are just too big and we have to do an extra reduction. The majority of patients are going to have one or two or sometimes even all three elements, and depending on their anatomical findings we have to make a plan that is best for you. The operation is therefore going to address the antihelical fold, the conchomastoid angle, and the conchal reduction as needed. All of the scars are going to be behind this ear. We're not going to be able to see them really, and the operation is going to be done in less than an hour and you get to go home on the same day. With otoplasties, our main concern is that we want to give you a very natural looking result. I oftentimes do see otoplasties that have been drastically overdone, where patients end up, they initially had very prominent ears and now you can no longer see their ears on photos because they have stuck them together all the way to the head. That is not our intended result. We want you to have a natural result that looks like you were born that way, like you never had surgery and with a completely hidden scar, and I think that's what we're going to achieve for you. The postoperative care after an otoplasty is pretty straightforward. We are going to send you home the first night with a big bandage around your head, and we are going to remove it here on the first day after surgery, and we will send you home with this elastic band that looks a little bit like an 80s bandana that you are going to have to wear for the first week, mostly when you sleep. You don't have to wear it during the daytime, but I don't want you to rub the ear forward while you're sleeping and possibly make one of those stitches pop. So to protect them, the first 7, maybe 10 days, we want that area protected with a bandage at nighttime only. You are going to have a little bit of bruising, a little bit of swelling, but it's going to go away pretty quickly. The sutures that we use behind the ear are all dissolvable. They're going to fall off by themselves. You don't really have to worry about them. There's no need for antibiotic creams or any special kind of wound care. It's all going to be closed and those stitches are on the inside and fall off by themselves. And it goes away after a couple of weeks. So I think you're going to love it and you're going to be okay. Thank you for choosing Ideal Plastic Surgery for your otoplasty. We have the most experience and therefore I am confident that we can give you the best possible results. Thank you.